Good afternoon, everyone, and welcome to today's webinar. I'm Christina Economos. I'm the interim dean of the Friedman School of Nutrition Science and Policy, and I want to welcome all of you here today. We're so glad you were able to join us. I have a couple of people to introduce, but before I do that, I really want to highlight the role that Tufts played in the lead up to the White House Conference in our commitment to supporting the goals of the White House Conference as a school. As many of you probably know, Dari, who I'll introduce in a moment, was instrumental for years in the work leading up to the actual conference in September. And his work really aims to create a food system that's nutritious, equitable, and sustainable. And he's been doing a tremendous amount of research as well as policy work to help bring together stakeholders across the country with similar interests to really change our food system and the policies that underlie them. So really pleased that you could all come today. So we will first have Dari speak, and then Dianna Bartone, who graduated from the Friedman School in 2017, who is the president of our Alumni Association, will be moderating a Q&A at the end of Dari's talk. And you can submit your questions through the Q&A function. And so now it's my pleasure to introduce Diarry Mozaffarian, who is a special advisor to the Provost and the Dean for Policy here at the Friedman School. Dari is a cardiologist, and he's the Jean Mayer Professor of Nutrition here at the Friedman School, as well as a Professor of Medicine at the Tufts School of Medicine. And as I mentioned, his work aims to create a food system that is nutritious, equitable, and sustainable. He's authored more than 450 scientific publications on dietary priorities for obesity, diabetes, and cardiovascular disease, and on evidence-based policy approaches and innovations to reduce these burdens in the US and globally. He has served on many, many advisory boards and plays important roles across the globe, and his work has been featured in a wide array of media outlets. And just recently, Thomson Reuters has promoted him as one of the world's most influential scientific minds. So we're so proud that he is one of the people listed, and he's here with us at Tufts. So without further ado, I want to welcome Dari, and we really look forward to you sharing with us what's gone on since the conference and what we can all do to be supporters of the efforts. Thank you, Dari.
Thank you so much, and welcome to all the alumni for joining. I'm grateful to Christina Economos for all of her leadership and work at the Friedman School, and she also has played a pretty meaningful role in national policy. As some of you may know, she helped lead Shape Up Somerville, an intervention in Somerville, Massachusetts, to implement a whole of community intervention to reduce childhood obesity. And that was done at the very earliest years of the Obama administration. And when then First Lady Michelle Obama heard about Shape Up Somerville, that helped crystallize her interest in creating a national program around healthier environments for children. And so when she launched Let's Move, the keynote speaker in the Rose Garden was the mayor of Somerville, because of the Shape Up Somerville experience. And so Christina's work, in a very direct way, helped influence national policy in the Obama administration. And so I'm going to share my screen now and talk a little bit about the White House conference. There's a lot to discuss, and so I'm going to be at a high level and then leave time for questions. How do we advance these goals to translate evidence into action to address hunger, nutrition, and health? Now, many of you are Tufts alumni, so you know this information, but it's still worth just highlighting how big of a problem food is. And I think, as I'll show you, if you put all of these elements together, our food system is actually the single biggest problem facing the country today, and the single biggest opportunity, bigger than any other challenge or opportunity facing us today. First, there's considerable food insecurity remaining in our nation. About 38 million Americans, including 12 million children, were food insecure at least at some point over the last year. And so that's about 1 in 10 of all households. And while these challenges affect Americans in every state, in both rural and urban households, and both Republicans and Democrats and all political persuasions, they're also higher among those who live in rural areas, have lower incomes, and are in traditionally marginalized, historically marginalized racial and ethnic minority groups. So for example, compared to the national average, food insecurity is almost 3.5 times higher in households living below the federal poverty line, almost 3 times higher for households led by single mothers, 2 times higher for Black households, 1.6 times higher for Hispanic households, and 1.5 times higher for households living with small children. Now, if we go beyond food insecurity to poor nutrition, Americans have a failing grade on nutrition. What this graph shows is the Healthy Eating Index, which is an index of the overall healthfulness of a diet from 0 to 100, with 100 being the best. And you can see on average, Americans are scoring about a 50 to a 60, and diets are worst in children and young adults. And so, you know, as an academic, I can tell you that a 50 to 60 out of 100 is a failing grade. And that's really not gotten much better over time in the United States. And importantly, there's not a single age, sex, racial, ethnic, or income group that has an average score above 65. And so this is really a transnational problem. And as I mentioned, diets are worst among young children and older children and young adults, ages 9 to 30, really the peak of when people should be having the healthiest diets. This is contributing to an epidemic of diet-related diseases. Poor nutrition is the top driver of death in the United States, causing over 500,000 deaths every year. The vast majority of adults are actually sick. Work from a Tufts doctoral student published earlier this year showed that more than 9 in 10 American adults have suboptimal cardiometabolic health. That means less than 1 in 10 adults are actually healthy. 7 in 10 adults now have overweight or obesity. 6 in 10 have at least one chronic disease. 5 in 10 have diabetes or prediabetes, and 5 in 10 have cardiovascular disease. We are walking around sick and not realizing it. And even among teenagers, 1 in 4 have prediabetes, 1 in 4 have obesity, and 1 in 4 have fatty liver. When 25% of teenagers have prediabetes, we have a major, major problem. And most of these changes have occurred in just the last few decades. And like food insecurity, these burdens fall on Americans who are lower income, rural, or in racial or ethnic minority groups. Now, beyond the impacts on food insecurity and nutrition, this is killing our economy through rising healthcare spending. Since 1970, healthcare spending has risen from just $1 in $20 in the federal budget to nearly $1 in $3 in the federal budget. And the same thing has happened in state budgets. So it's squeezing out every other priority in government budgets. As a proportion of our economy, healthcare spending is almost $1 in $5 in our entire economy. And 86% of healthcare spending is for chronic diseases. Many of these are diet related. And if you put together the healthcare costs and the lost productivity of diseases directly attributable to poor diet, our poor nutrition is estimated to cost over $1 trillion in estimated economic losses each year in the United States. As if that weren't enough, this is also straining military readiness. Nearly 1 in 3 young Americans do not qualify for military service due to excess weight. This is the single leading reason that young Americans can't qualify for the military. And so Mission Readiness, a wonderful group with whom we collaborate of over 750 retired admirals and generals, has put out multiple reports like this one, Unhealthy and Unprepared. National security depends on promoting healthy lifestyles from an early age. As General Richard Myers said, the 15th chairman of the Joint Chiefs of Staff, basic training lasts weeks, but building strong troops takes years. Encouraging healthy lifestyles early in life will help our nation prepare for future challenges. So if you put together the issues of food insecurity, poor nutrition, diet-related diseases, economic consequences of healthcare spending and lost productivity, strained military readiness, and I'm not going to discuss it today, and sustainability issues, issues around our natural resources like water and soil and climate, food is really the single biggest challenge and opportunity facing our nation. And there's a huge positive here. If we address food, we can unlock business innovation. Right now, already, about 1 in 10 US jobs are directly supported by the food and agricultural sector. And this contributes about $1 trillion to the nation's economic output, almost $200 billion in exports. And this is not only a source of jobs overall, but this is particularly a source of new small businesses and new jobs in rural areas and in racial and ethnic minority communities. There's actually food sector businesses are the #1 source of new businesses and jobs in racial and ethnic minority communities. And at the same time, consumers are demanding healthier, more authentic, more nourishing foods. And so there's huge business potential for the United States to become the 21st century global leader for healthy, sustainable, and equitable food. Now, the public gets this more than ever. A lot of this is driven by COVID. And so today, more than half of adults now say they're following a specific eating pattern, 52%. That's a huge increase from just 2021 when it was 39%. And so COVID has really let people understand how important food is to them. And the biggest increases in this attention have actually been at the younger ages, adults ages 18 to 34 and 35 to 49. And this is the list of different patterns that people are following: clean eating, mindful eating, calorie counting, plant-based. What's a little bit unfortunate is that most of the diets on this list are not that strongly evidence-based. And so while the public is very interested in food and nutrition, they're not necessarily always doing the right thing. The other really interesting thing is the top reasons and goals. It's not just about weight and obesity. The top 6 goals are increased energy. That's actually the top goal for Americans to eat a special diet, is to feel better. Then weight management, but then also gut health, cardiovascular health, improved sleep, and better immune function. I think that's a direct consequence of the COVID-19 pandemic. Now, at the same time, we have all of these problems and this skyrocketing public attention. We have an explosion of nutrition science. And what this chart shows is the number of scientific publications published in every decade from the 1960s on diet and cardiovascular disease, diet and diabetes, and diet and obesity. And you can see we've been doubling the science every 10 years. And so we are at a really special moment where we have tremendous problems that we're facing. And at the same time, we have a tremendous opportunity because the science has advanced to a point where we can actually start to move forward. What does the science show us? Well, first, the science shows us that we can sort of group foods into, sort of the good, the bad, and the ugly, you might say. First, there are protective foods. There are foods that are really good for us: fruits, nuts, fish, vegetables, plant oils, whole grains, beans, and yogurt. We have to be emphasizing this. This is a positive message for the public, for farmers, for industry, for policymakers. We have to get more of the good into our food supply. Then there are foods to eat in moderation, mostly minimally processed animal foods. And cheese actually might be a little bit good for us because it's fermented, and there's evidence that fermented foods are healthier. And unprocessed red meats, a little bit bad for us, not because of the fat or the cholesterol, but because of actually the heme iron. Heme iron is a powerful oxidant, and we get too much heme iron, it damages the pancreas and causes inflammation. And then the worst thing in our diet is actually all of the processed plant foods and processed animal foods, like processed meats. And notice I said processed plant foods because I really don't like the term plant-based diet, because processed plants are actually one of the biggest problems in our food supply: processed grains, starches, and sugars. We've also learned, beyond kind of thinking about foods, that we have to go beyond counting calories. If we want to address obesity, we have to stop focusing on counting calories and really focus on food quality. There's many papers showing how interesting and complicated the impact of food is on our risk of obesity, independent of calories. We're also learning that we have to think about many other pathways beyond obesity. In the 1980s, we were focused just on blood cholesterol levels or blood lipids, and that led to the low fat, low saturated fat diet focus. Today, we're mostly focused on obesity, which is leading people to count calories. And both of those are too simplified. We have to think about how food affects blood pressure, inflammation, the brain, the gut microbiome, the liver, fat cells, and much more. We have to understand the role of food processing. This is a trial that I'm going to not cover in any detail, but basically it showed even accounting for diets and making them similar in fat, sugar, salt, carbohydrate, protein, dietary fiber, and energy density, there's something about processing that makes people eat more and gain weight. And so if you take the same nutrient composition of a food, but you just make it more processed, people eat more and they gain weight. This is an area that we need to understand more. And so we know at the end of the day that we can't continue what we're doing, which is to focus on single nutrients and calories, because low calorie doesn't mean less weight gain, fat-free doesn't mean healthy, and low saturated fat or vitamin fortified doesn't mean good for you. So how are we going to do all this? How are we going to grab this opportunity? We need to have policy and systems change. When you have 1 in 4 teenagers with prediabetes, when you have 7 in 10 adults with overweight or obesity, there is a systems problem. The system is broken, and so you have to fix the system. And so over many years, the Friedman School has helped develop the policy science for how to fix our national and international food system. And there are really 6 important domains: healthcare systems, government nutrition programs, science and research, public health and education, business innovation, and overall national coordination. How in the heck are we going to get a national program across all of these areas done and implemented? This is why, we thought it was really important to have a White House conference to talk about these issues, because all of the major progress we've had, where there's really been kind of a watershed moment in food and nutrition policy, has been around these national conferences. The first event in modern history that is probably important to cover is in 1941. While this wasn't a White House conference focusing on the whole government, President Franklin Delano Roosevelt in 1941 called for a national nutrition conference for defense. And he did this because we were going into World War II, and he knew we had to have a fit military, particularly with a focus on vitamins, because just in the previous 10 years, the science had dramatically advanced around vitamin deficiency diseases caused by insufficient intake of specific vitamins. And so this conference was to create a plan for coordinating the programs and activities of national, state, and local public and private agencies into a unified program for the promotion of better nutrition. And again, better nutrition at this time was defined by just a handful of specific vitamins. And so it led to major national actions. It actually led to the new national standards and expansion of vitamin-enriched flour, enriched with folate and other B vitamins. It led to the first RDAs, which many people read on the back of PAC, came out of this conference. And it led to the first science-based, food-based national dietary guidelines, which were based on the RDAs. And so this was a conference really focused on vitamins. And it had major positive impact. After this conference, with supplementation and a focus on vitamins, vitamin deficiency disease in the United States substantially decreased. But then in the 1960s, just 20 years later, there was recognition that beyond vitamin deficiencies, there was families around the country, people around the country who literally were starving, who were not getting enough calories. And you had these images from Senate tours. Senate Robert F. Kennedy toured the Mississippi Delta, from Al Clayton did something in Look magazine, from a CBS documentary, Hunger in America, showing children with emaciated arms and distended bellies. And this shocked the national conscience. This shocked the Senate's conscience, particularly Senator Robert F. Kennedy and other colleagues like George McGovern and Bob Dole. And so that led to kind of a focus to think about this. And I just want to digress for a minute to mention, Robert F. Kennedy went into the Mississippi Delta. I want to highlight Dr. Jack Geiger, who recently passed away, who, when he was a Tufts School of Medicine faculty, created the first community health center in the country in Boston, and then the first rural community health center in the Mississippi Delta in 1967. And I just highlight this because this is all related back to food, because after Dr. Geiger created the first rural community healthcare center, the government was auditing its budget and found he was actually using pharmacy dollars to pay for food. And so they sent an auditor down to Mississippi. The auditor confronted Dr. Geiger and said, "You can't do this. You can't spend the pharmacy budget for food." And Dr. Geiger said, "Well, the last time I looked in my medical textbooks, they said the specific therapy for malnutrition was food." And so Tufts has been long in the fight to help integrate food and nutrition into health. All of that attention on hunger led to the 1969 White House Conference, which was organized by Dr. Jean Mayer, who went on to become the president of Tufts and found the Friedman School, found the Human Nutrition and Research Center on Aging. And that conference was really remarkable. It had bipartisan support from Senators George McGovern and Bob Dole and others, support of the president, support of the White House. And it really, really changed our US food policy again. Major expansion of the food stamp program from 2 million to 11 million recipients, major expansion of school lunch from 2 million to 8 million children, creation of WIC, which today feeds 1 in 2 babies born in the United States, creation of the school breakfast program, creation of the nutrition facts panel, creation of the modern process for the dietary guidelines. So this was a very, very important process. But here we are 50 years later, and after 1969, while we've addressed vitamin deficiencies and we've addressed chronic insufficiency of calories, we still have food insecurity, poor nutrition, diet-related diseases, challenges to national security, rising healthcare spending. And so we thought it was very important that we have another White House conference to really bring together the government to address these issues. And so we've been working really since 2014 and the Obama administration, throughout successive administrations and with Congress to advocate for this. And we were really, really delighted when President Biden decided to have a White House conference. And we've been working at Tufts from the very beginning with the White House to do our best to inform and advocate for this conference. And one of our efforts, which I want to highlight, was a task force we put together, an independent task force, not officially sanctioned by the White House, to bring together multiple sectors to give recommendations to end hunger, advance nutrition, and improve health in the United States. This task force was co-chaired by Chef Jose Andres, the founder of World Central Kitchen, Ambassador Earthren Cousin, the former head of the United Nations World Food Program, Senator Bill Frist, a surgeon and former Senate Majority Republican leader, and Secretary Dan Glickman, former USDA Secretary of Agriculture. So a really diverse bipartisan group of leaders to think about how are we going to address hunger, nutrition, and health. We had a terrific task force, which included leaders from the farming community, from the business community, from the medical community, advocacy community, many, many others. Happy to share this list, and it's on our website for people who are interested. And we brought in a strategy group of major national organizations to give us additional guidance on what they wanted to see in a national strategy. Groups like Commonwealth Kitchen here in Boston, the National Alliance for Hispanic Health, Maison, a Jewish Response to Hunger, Partnership for Healthy America, the Nature Conservancy, many, many other important national groups. And with this structure of the task force and the strategy group, we held 16 listening sessions around the country, including people with diverse lived experience in hunger, poor nutrition, and diet-related disease. We held 3 national policy convenings in Washington, D.C., in New York City with Mayor Adams, and in Oakland, California with Kaiser Permanente. We reviewed over 75 policy reports, and we came up with very concrete recommendations in this final report, which I really encourage everybody to read. You know, this report is not the final White House report, but it does represent, I think, the only true multi-sector consensus report on U.S. food and nutrition policy in the last 50 years. And so if you really want to understand how a group of diverse stakeholders, bringing in input from across the country thinks about food and nutrition policy, I think this report is quite interesting. And when the White House conference was finally held, we gave that report to the White House before the conference. When it was finally held on September 28th, it focused on these 5 pillars: improving food access and affordability, integrating nutrition and health, empowering consumers, supporting physical activity, and enhancing research, all with the goals of ending hunger, improving nutrition, and reducing diet-related chronic diseases by 2030. Now, the day itself was terrific, really wonderful talks. Many cabinet secretaries, senators, congressmen, the president were there, and also people with diverse lived experience were there to talk about these issues. But the important part of the strategy of the event was the national strategy. The White House had been working on this. All the agencies had been working on this with an interagency working group for more than a year, really to come up with actionable, ambitious actions that they could really take to end hunger, improve nutrition, and improve health. And I can't go into the whole report, but again, I really encourage people to read this report. I'm just going to give you some high-level summary points around improving food access and affordability. These are some of the really high-level points in the national strategy: to move toward universal healthy school meals, to have summer EBT where for all kids, where SNAP dollars are supplemented in the summer, to increase fruit and vegetable incentives in SNAP, to make retailer standards for SNAPs stronger, to increase nutrition standards for school meals and WIC, to streamline enrollment and use of SNAP and WIC, including online, to increase tribal food sovereignty and access to traditional foods, and to increase breastfeeding support and counseling. A second really exciting area, just as an example, is to integrate nutrition into healthcare. This is really, really exciting, and Tufts is really a national leader in research and implementation around these kinds of food as medicine approaches. The national strategy includes actions to incorporate medically tailored meals and produce prescriptions and reimbursement for RDN counseling for obesity into Medicare and Medicaid. It includes produce prescriptions in the Indian Health Service and Veterans Affairs hospitals, increasing access to programs like the Diabetes Prevention Program, creating a stronger, more diverse RDN nutrition workforce, ensuring nutrition training and nutrition education for doctors and other medical providers, and more. And there's many, many more things. I'm just going to show this slide and not even go into it. This is under empowering consumer choice and access. There's many, many things here about procurement, supporting small businesses and innovation ecosystems, creating local food systems and regional food business centers, increasing FDA funding for food and nutrition, creating a new US front-to-pack labeling system, and much more. If you're interested in sort of a high-level summary of this, just earlier this month, a few days ago, I published a short perspective with a summary table on the White House Conference on Hunger, Nutrition, and Health. My thoughts on what were the strengths, what are other areas that could be even stronger, and how do we need to implement it. I'm happy to share this PDF with anyone who's interested. And so I just want to end with talking about what's next. And here's where we can also hopefully have some discussion in the questions. Tufts has been very involved, as we've described, with the White House and other agencies and leaders in Congress for many years, talking about these issues, including around the White House. And we're not going to stop now that the White House conference has happened. To me, the White House conference is the beginning. It's actually the beginning of the beginning. It's a watershed moment when all the agencies came together, bipartisan leaders in Congress came together, the private sector came together, advocacy and civil society came together to really tackle food. And it's changed the conversation. It's changed the way people are thinking about food and nutrition. But that doesn't mean anything's going to happen. And so to really ensure things are going to happen, we have to continue to have outreach, advocacy, education, accountability. And so at Tufts, I'm envisioning that my own advocacy work is going to focus in three particular areas where I think Tufts has a unique and leading role where we can really make a difference. That's around food as medicine, integrating food and nutrition into healthcare, into advancing investment and innovation in nutrition science, and ensuring nutrition security across all of the federal programs, including the federal nutrition programs. There are many, many other priorities in the national strategy where Tufts will also play a role, but there are many, many other groups in the national arena doing that work. And so Tufts doesn't need to play a leading role. We can be supportive and be a partner and be a collaborator. So we really support all of the national strategy. It's all terrific, but these are three areas where I think we can play a leading role. And we're developing now a 3-year plan with sort of short-term and longer-term actions for outreach and advocacy to the agencies and to the White House, to Congress on both sides of the aisle, to the private sector, including the food sector and the healthcare sector, to communicate and disseminate these happenings to the media and to the public, and to really ensure commitment, action, and accountability. So thank you so much for joining and listening, and look forward to discussion and questions.
Well, thank you so much, Dari, for that presentation. I think that's my cue. So I just want to thank you and Chris for taking the time to speak with the Friedman School Alumni and Friends community today and share the results of and some really interesting history and nutrition science associated with all these efforts with us as well. And to thank you both for all of your leadership throughout the years in these areas and beyond. Personally, I have only grown more proud to be a member of the Friedman community over the years, and it was a pretty high starting point. So yeah, just thank you for everything and taking the time to share this with us. So to everyone on the line, please feel free to ask your questions in the Q&A chat box. We have plenty of time for discussion, so please don't hesitate. And a quick plug for the Alumni Association. If you're interested in becoming more involved in the work of the Alumni Association, with just learning more about what we do and what you can do to become more involved, I think Courtney, you can put a contact email address in the chat, or if that's not working from the technical side of things, you all can just Google Friedman School Alumni Association, go to the page, and there's contact information on the page. So with that, we can begin the question and answer session. And Dari, if you don't mind if I start, I was just interested to hear what the biggest surprise for you was coming out of the conference. I'm sure, after so many years of efforts, you had a pretty solid idea of what to expect, but were there any surprises either during the conference itself and perhaps or since then regarding how the kind of implementation environment has changed? We have, global inflation going on right now, which is affecting the US, just as it is elsewhere. So yeah, what has surprised you during the conference?
Well, I don't know if I can think of one, but I can definitely think of a few positive and negative surprises. And so some of the really positive things that, I don't know if I'll push all the way to surprise, but might not have happened. And so I was so pleased did happen. Was first, in the 5 pillars of the White House conference, it was really wonderful that one of the pillars was advancing nutrition science. And we had been separately working on an effort to advance nutrition science, had published a white paper on this, had been talking to the agencies in the White House about this for about 4 years. And so I think to see that, as an academic institution, to see that focus on science, to actually be a full pillar of the 5 pillars of the White House conference was really terrific and really positive. On the negative side, in that same theme, compared to the other 4 pillar areas where there were really ambitious new things presented and proposed by the agencies, I felt that area was maybe one of the least innovative and one of the more vague ones. And so the specific things that were presented there were mostly things that were already happening. And some of the new things that were stated, like increasing nutrition investment, were a little bit less specific, a little bit more vague. That's not to say there aren't great things in there. There still are great things in there about, diversifying the nutrition science workforce and other things. But I thought that was, again, a positive and also maybe a little bit of a negative. I think another thing that, again, maybe not a surprise, but something that I would have liked to see a little bit stronger was more of a focus on nutrition security in SNAP. And I think that there was a strong focus on nutrition in WIC and school meals. And yet that focus on nutrition in SNAP wasn't as strong as it could be. And I think that's partially because there's historically been, I think, a false artificial separation between sort of the anti-hunger community and the nutrition and public health community, as though focusing on nutrition and focusing on hunger are 2 different things, or even antithetical to each other. And what we've learned is that food insecurity and nutrition insecurity, hunger and diet-related diseases, are flip sides of the same coin. And so that was a real positive that I think most of the different groups, since the Friedman School, right, does all of this, right? We do research in food insecurity and hunger, we do research in diet-related diseases and nutrition. I think we were viewed by many as an honest broker who could bring these groups together, and we tried to do that. And so that was a positive surprise that all these groups did mostly come together, but again, a little bit of a negative surprise that there wasn't really very much, there wasn't enough in SNAP as a tool for improving nutrition security as there could be. So I think that those are some things I would highlight. To me, I guess if I really step back and take the 30,000-foot view, it's just amazing this happened at all, right? Like there are so many reasons this might not have happened. For this to happen, I do want to emphasize this was not a one-day press junket for the White House to just get attention, right? For Ambassador Susan Rice, who leads the Domestic Policy Council, to agree to really take this on, for President Biden to agree to take this on, for Secretaries Becerra and Vilsack and others to agree for their agencies to take this on. They all committed that we're only going to do this if we're really going to move these things forward and make a difference. And so I think that's really kind of amazing. I mean, we really are at an amazing moment where you hear government leaders, you hear the president, you hear secretaries in the cabinet, you hear others in the government talking about nutrition and health, talking about food insecurity, talking about disparities due to poor nutrition. Like that never happened before, never, right? So I think that is maybe the biggest surprise that this happened at all. And I think we have to now take a breath and hold our leaders accountable and tell them this is important to us.
We have a question here from the audience regarding the how of that. So the question is, with the state of Congress and the Senate, I'm struggling to be hopeful that the national strategy will come to something. What can we do personally or through our research to advocate or influence policy to make things happen?
Yeah, so what was great about the national strategy, a real positive, is that it's organized into things the government can do and things that the private sector and civil society can do, and they have sections in there recommending that. And so I think, again, I really urge everyone to actually just read it. It's about 40 pages, takes about 20 minutes, 30 minutes. It's worth reading the whole national strategy because this is a blueprint for what we can do. And then you can identify first things that your own organization can do around moving things forward, because the White House identified, and we in our report identified many things non-governmental actors can do. Second, within the government actions, there are many, many actions that the agencies can do through rulemaking and policy without Congress. And so those things should happen as long as the agencies don't get distracted and overwhelmed and kind of have enough bandwidth, because it's the agencies themselves who wrote those commitments and put them into the White House strategy. It's the agencies themselves who have committed to it. So that means that we need to ensure those things happen. And so, for example, we're preparing letters to various agency leaders highlighting the national strategy, highlighting their commitment and saying, we really want this to happen, and getting signatories so that, in their list of 100 things to do, it's not number 99. But the agency things should happen in the next 2 years. I think for the things that require congressional action, I think the things that are basically highly progressive goals, like dramatically increasing funding for some of the federal nutrition programs, those things might be more challenging, some of those kind of traditional progressive things. But I think that other things that have been much more bipartisan. And so among those, I think food is medicine, integrating food and nutrition into healthcare, has been strongly bipartisan in all of my conversations. And if anything, Republicans are even more interested in that than Democrats most of the time. I think advancing nutrition science has been strongly bipartisan. And I think nutrition security as a concept is more likely to be bipartisan, because there we're saying that, look, we need to spend federal dollars to not only give people food, but give people healthier food that then lowers healthcare spending, makes them more productive, helps the national economy. So I think that there are things that are quite positive. And I actually don't think the House switching makes that big of a difference in what can happen, because again, for any of this to happen, you need to have sort of folks on both sides of the aisle in Congress that agree to have it happen. So, big picture summary, there's stuff the agencies can do. I think we can get some things done with Congress in the next 3 years, particularly bipartisan things. And there's a lot of things for people outside the government to do as well.
Thanks so much. Yeah, it's always challenging to be optimistic when it comes to anything that involves politics. But like you said, it's a very exciting time. And, I think we can all identify those, positive aspects and use that as energy to really try to do our part. With that,
and since it's such an important point, let me add a little bit to that. I mean, some of the things that we've done to highlight bipartisan support is we helped, along with Congressman McGovern in Massachusetts, who's a terrific champion, and we should thank Congressman McGovern and the late Congresswoman Walorski and Senators Booker and Braun for their work in making sure the White House conference happened. But we helped organize and do some of the first briefings for a Food is Medicine working group in the House. So there's now a Food is Medicine working group in the House, and there's interest, and there may be a Food is Medicine working group announced in the Senate that's bipartisan. So as just two examples, right? There's a bipartisan diabetes caucus in the Senate that's very active and very interested in diabetes. So there are a lot of things that are actually bipartisan, more things than people recognize. So sorry, go ahead.
No, that's wonderful. And that's actually a great segue into a question about the Friedman School's work in the food is medicine realm. The question is about the school recently receiving a significant NIH for food as medicine intervention in the Mississippi Delta. The attendee would like to know if you could speak more about that, about the Friedman School's role, student involvement, and what you anticipate that you might learn from it.
Well, if Dean Economos is still on the call, I'll invite her back on to talk about that specific grant. I will say before passing it on to her that the school in the last 5 years has received 10 grants in food as medicine, and we received 2 NIH grants this last year, both large multi-million-dollar grants. We've received funding from Kaiser Permanente. We received philanthropic funding from a major individual donors. We've received a grant from the Rockefeller Foundation, from the Bristol Myers Squibb Foundation, many others. And so we are really pushing forward work in food as medicine, which again is about how to think about integrating food and nutrition into prevention and treatment of disease from across the food system and the healthcare sector. So, but I think this particular grant that the questioner asked about is really exciting, one of the most exciting among the other projects, and it's led by Dr. Economos.
Yeah, I can jump in for a moment. Thanks for the question. And as Dari said, there's lots of work going on at the Friedman School. I think at this point, we may be one of the largest cluster of research going on. So this one is unique because it involves the food system and the healthcare system and the community. So it's a large grant. It's almost $7 million over 5 years. And the first phase is community engagement to understand the population in the Delta and what type of food as medicine intervention will work, as well as working with local farms to scale up production. So the food as medicine offerings will be locally grown fruits and vegetables. So we're working with 5 farms, scaling up production over the first year, talking to the community, and then we'll conduct a randomized controlled trial with Delta Health Centers. And I just came back from a trip down there last week, kind of reuniting with some of the people who were instrumental in forming it in the 60s. So the current CEO was a young man at the time and worked with the physicians from Tufts. So it's a real full circle initiative, and they are so excited about working with Tufts, and they can't wait for students to come down. So there's lots of opportunities this year for community engagement. We've partnered with Tougaloo College, which is a historically Black college in Jackson, Mississippi, and we have a whole team of students there who are working on the study. So whether it's the agriculture piece, the community engagement and piece, the data collection piece, or ultimately the policy work, where we'll inform policy with the results that we're getting. So we have a postdoc that we're going to advertise for soon. We'll have a doctoral student working on it. We're hoping to write a couple of NIH diversity supplements. So I would say if anyone knows anyone's interested, please get in touch with me. There's a lot of work to do and a tremendous amount of opportunity for training. So thank you for letting me say a couple of words. And we're really excited about adding to the robust work going on at Friedman already. And hopefully with all of us working on this, really producing the necessary evidence to really move or institutionalize a lot of what you talked about, Dari, into our healthcare system and our healthcare spending. Thank you.
Yeah, and thank you. And 2 of my doctoral students who are now graduating, this work, kind of larger work around food policy and food as medicine, were core parts of their thesis, and really they really advanced the field considerably. I have 3 postdocs who are working in this area. And like Chris, I'm also hiring. And so we recently hired a research assistant professor, Ronit Rydberg, in food as medicine. We have funding and availability for doctoral students, postdocs, research assistant professors, RAs. And so anyone interested and who has abilities and qualities in these areas should also reach out and contact me. Or if you know someone, please let them know to reach out.
So we have another interesting question here on the food as medicine front. I'll read it. It says, based on the $8 billion committed from the private sector, $2.5 billion will be invested in startup companies addressing food and nutrition insecurity, and $4 billion toward initiatives improving access to food, and philanthropy promoting healthy choices. The question is, how will Tufts create the imperative to continue to drive the importance of the medicine that food represents, advancing the science of nutrition in addition to the access? I think it's so critical that we continue to demonstrate the criticality of food and nutrition as medicine, particularly given a world of increasing exposures, pandemics, and immune exhaustion. Is Tufts position to get in front of this, and how? So Dari, I think you've already answered this in in many ways, but I think based on the thoughts expressed and comments of this question, I wonder if you have any additional comments to make about work with the private sector or involved in utilizing those funds that has been committed, or any other thoughts you'd like to add.
Yeah, so I'm not sure if the question is more around what Tufts' role will be in advancing the science, what Tufts' role will be in working with the private sector, or what Tufts' role will be in kind of driving this public recognition. So I wasn't quite sure, but we're doing work in all of those areas. So I'll just kind of briefly touch on them. And so I think in the in the research area, as I mentioned, we are doing our own research, but we are also pushing and promoting for more nutrition science. And so we have three specific goals right now. One is to fully fund the Office of Nutrition Research in the NIH Office of the Director. This is a new office that was created in the NIH Office of the Director last year, partly because of our own advocacy and specific recommendation that this office be created. It can be a very powerful office to coordinate NIH research because it's in the Office of the Director, and it needs to be fully funded at around $100 million, which is where the president requested its funding. That probably won't happen in 2023 because of all the challenges around appropriations, but we're hoping it'll at least be significantly funded and then fully funded the following year. And so that's one of the things we're doing. Second, we're continue to advocate for a new National Institute of Nutrition at NIH. It's time to create a 28th institute, the National Institute of Nutrition, to have $1 billion, $2 billion a year institute that really leads nutrition science. And lastly, we want to continue to promote what's already happening, which is the USDA continuing to shift its research not only to focus on production agriculture, but the linkages between production agriculture, human health, planetary health, and equity. And so those are kind of our three goals around nutrition science. Really briefly around working with the private sector, one of the things we've done over the last 8 years is turn Tufts into the leading global hub for academic private sector innovation around food and nutrition. And so the Food and Nutrition Innovation Institute, maybe Heather can put the link in the chat, the Food and Nutrition Innovation Institute, which is a cross-university institute now led by Executive Director Katie Stebbins, is the largest academic private sector collaborative around food, business innovation and food and nutrition in the world with over 100 members. And so we're really working closely with the private sector to ensure that innovation happens that's mission oriented to the school's mission and to our goals, which is not just to go from Doritos to Cool Ranch Doritos. That's not innovation, but to actually create healthier products that are more equitably distributed and more justly sourced and made and more sustainable. And so that's very, very positive. And we're also working with the private sector, with major trade associations, to have companies come up with new commitments, because $8 billion sounds like a big commitment, but just SNAP is $110 billion a year. Just the healthcare spending on diabetes is $160 billion a year. And so $8 billion is a drop in the bucket, really. There are some important commitments in there, but we need 100, 200, $300 billion of commitments. And so we're starting to work with the private sector to generate those commitments as well.
Thank you so much. Yeah, it's wonderful that the Friedman School has developed over the years into such a leader, just given the sheer importance of it and the leverage that is needed to work with these private sector companies in these ways. A question now about the role of the media in all of this. The question is, was there a newspaper and magazine contingent to have the news media change their message to Americans to eat whole grains instead of the same old white flour products? And I might add to that question with a more broad question about the role of the media and any commitments from their side that were involved. Thanks.
That's a really interesting question about commitments from the media. As you know, the school has had, one of the oldest and most respected programs in nutrition communications, which is, expanded to incorporate interventions and community interventions and behavior change into our NICBIC division. And nutrition communications is really important. We have thought a lot, I have thought a lot about how to work with the media. The school is never going to be a direct to the public communicator, right? We're not going to compete with Fox News and ABC News and CNN and all the websites and the Atlantic. And we're just not. Like their entire model is to communicate, right? So what we have to do is communicate to people that then communicate to others. And I think the three most important targets for us are the media themselves, policymakers, and the private sector. If we communicate to those three groups, then messages flow to the consumer, because all of those groups have huge consumer audiences. And so I think that's the first point, is that, you know, we're thinking about how do we communicate to business so they can communicate to the consumer, how can we communicate to the government, and how so they communicate to the consumer, and how do we communicate to the media. It is an interesting question of, can we rein in and call, you know, the media to make commitments or do things? I think they have a very tough business model, right? They have to get clicks to get ads, and to get clicks, you have to write titles and headings that are you know, usually not moderated and sort of sober, but a little bit dramatic and a little bit overstated. And so if a paper finds that whole grains are good for you, nobody's going to write that headline, right? If a paper finds that, you know, some weird thing that doesn't make sense, that'll be all over the headlines. And so I think it's a very tough business model for the media. But we are trying through op-eds and through communicating to the media and through our papers and putting those out to communicate to the media. The last thing I'll say is we co-hosted this meeting in Washington, D.C. at the end of October with FMI, who's the major trade association for retailers and many food manufacturers, to talk about what the food sector can do following the White House conference to support the national strategy. And one of the ideas that came up, which we're going to try to talk to the White House about and to keep percolating, is could food industry get together with the Ad Council, which does a lot of major nonprofit ads, together with the White House, together with major media producers, which would be not only traditional outlets, but, you know, many of the online outlets, to come up with a national program to promote healthier eating among Americans. Everybody in the room, all the leaders in the food sector, all the food manufacturers, retailers, were really, really interested in that. They really, really wanted a national program to educate Americans about healthier eating, because many of them say we make healthier choices all the time and they don't sell. And so if we really want to do this, like, they have to sell. We have to be able to make these products and have to sell. So I wonder if we could help organize kind of a coalition to create kind of a national media program, like has been done for anti-smoking, or like has been done for some other things over the years, that really, really elevates healthier eating. But it's a very complicated area, and I'm not much of an expert.
Fascinating. Yeah, that is a lot of good food for thought, and I'm sure we all agree about the importance. Yeah, thanks so much, Dari. Now, another question that we have here is an interesting one, given that all of this is taking place within the realm of policy. So in a way, you know, it's an interesting one to even think about. So the question is, how do we combat the idea of a nanny state? You know, was there thought about this, given that this is all about policy, or was it not discussed, given that from the beginning, this is already all about policy?
Well, it was certainly considered, but, you know, there's it depends on what is considered a nanny state, right? And so I think you know, the things that we called on stronger language for regulation would include things like additives, you know, things like salt and added sugar, where you know, direct regulation is important. Another area for direct regulation that we called on is for restricting marketing to young children, because young children can't perceive differences between advertising and programming, and so it's actually literally deceptive, and so deceptive advertising is not allowed. And so there are areas where we called for direct regulation, where some might feel that's kind of nanny state-ish. I don't think that having stronger nutrition standards in schools is nanny state. That's just common sense, right? I don't think that going to your doctor and having your doctor write for a prescription that gets you fruits and vegetables instead of a drug, or instead of surgery that costs more, that's not the nanny state. And we also included many recommendations for business innovation and policies that support business innovation, using the Department of Treasury, using the Small Business Administration, using the Department of Transportation, using Housing and Urban Development to promote food businesses. The country has done that for clean energy, right? We have lots of federal programs to promote clean energy. We've historically done it for other industries like railroads and other things. So I think that the overall national strategy and our overall task force report and goals aren't really kind of about dictating to consumers what they can't and can't consume, and that's what most people would consider the nanny state. It's more about just righting the ship, right? We have a broken economic system where people don't know what's making them sick. The food they're buying is hurting them and hurting the economy and hurting children. And that's a broken economic system. And we need government action to fix it. And the food industry actually wants government action to fix it because they need kind of to have a level playing field. And so I think that's it's something that we did keep in mind, and we do have to keep in mind. And I think our recommendations and the things we're going to focus on do largely avoid that.
Thanks so much, Dari. We have time for one more question, I've been told. So to end on a little bit of a high level, big picture note, I was thinking about moving forward from here. The question is there one policy recommendation that you most want to see implemented? That's a tough question, of course. I'm sure there are many, but I'd like to add to that and ask, the last White House conference, there were so many recommendations. I think it was 1,800 recommendations that came out of it, and a surprisingly high percentage actually came to fruition over the years. Do you have any feelings about the strategy involved in the advocacy from here on in? The Friedman School is obviously focusing on pushing in the areas of its strengths. So should we all, go forward and just push for whatever we feel most passionate about and are in the areas of our strengths? Will there be opportunities as a Friedman community to kind of rally behind the Friedman School's priorities? What are your thoughts around, how we can kind of coordinate, or whether that's even needed versus an approach of, just let's try to push for everything here, and hopefully what is able to be implemented will come through.
Well, I'll start with the second part of the question, which I think is a more important question to maybe end on. If we have time, we'll go back to the first part. But I think for the second part, it is absolutely essential for everyone on the call to be active in this. It's really remarkable what a handful of people can do if they're all kind of rowing in the same direction. That's how policy change happens. It's not from millions and millions of people all voting in one direction. It's from a handful of people really pushing forward things. That's how the NIH was created. That's how the CDC was created. That's how the National Cancer Institute was created. That's how the school breakfast was created. WIC was created. It's just a handful of people who really are passionate and care about things and show the evidence for this. So first, definitely read the national strategy. And if there's anything you care about that's Congress needs to do, literally find out who your House representative is and who your senators are, and just call them. Just call them. Don't even write them. Just call them. It really doesn't take that long. They have a public phone number. Call them up and say, hey, I saw this national strategy, and I just want to say this is really important to me. I hope you do this. I have been in so many offices, and many people on the call have probably been in so many congressional offices. If they get 10 calls in a week, that's a landslide for them, right? And they will pay attention. So literally there are elected representatives, and for things Congress has to do, just call your elected representative and tell your friends to call them about whatever you think is important, and that will genuinely make a difference. I think second, for the agencies, it's a little bit harder to get in touch with the agencies. So for those things, you kind of need coalitions and working, things like that. We have a Food and Nutrition Advisory Coalition, the FNAC, that is composed of nonprofit and for-profit organizations, a coalition of organizations who've come together, an ad hoc coalition to support our work. And so we don't ever speak for the whole coalition, but when we have letters we're sending or briefings we're doing, we can contact them, let them know, and whoever wants to sign on can come on and support that. And so for anyone who's in an organization, for-profit or nonprofit, who wants to join the FNAC and kind of be a part of that conversation, I think you should do it as well. So I think that's really most important. And I guess I'll just really briefly say, there's no one thing that's going to fix food, right? We need to do about 10 or 20 of the things in the national strategy, and all together they'll work. That's why we needed a White House conference, right? If we do any one of them, it'll be helpful, but it'll only be incremental. But if we do all of them together, it'll really, really make a big difference. So thank you so much.
Thank you so much, Dari. We're at our time. So I'd like to thank everyone once again for joining. Thank you and Chris for all your leadership. This is, again, a really exciting time, and it's, you know, wonderful to be part of the Friedman School community. Over the years, you know, the pride, it just keeps growing and growing. So thanks for everything. And if you'd like to offer some closing remarks, please feel free.
Well, I'll just say thank you, Dianna, for your leadership, and to everyone in the Alumni Executive Council for all that you do. And we have a tremendous and amazing group of alumni, and it was so wonderful over the work that I've done, whether I'm talking to the private sector, or talking to foundations, or talking to the government, how often it was like, oh, I'm a Friedman School alum. Like, it's really amazing where our Friedman schools are, alums are, and what they're doing. So thank you to all of our alums, and to all Tufts alums from other schools as well. So thank you so much.
Thank you. Thanks again. And thanks, everyone.